This video I will be going over the path of blood. So first, blood is going to go through either the superior or inferior vena cava, which are two veins that return deoxygenated blood back to the heart from body tissue. Sorry, I have allergies right now, so my voice is bad, but so deoxygenated blood will go through either the inferior vena cava if it is under the diaphragm, or if it's above the diaphragm, if it's returning from tissues above the diaphragm, it'll go through the inferior vena cava. So once it's in the inferior vena cava, it will go through the right atrium, and it'll go down here, and then there's a valve right here. We're going to call that's called the tricuspid valve. So the four chambers of the heart real quick: the right atrium, the right ventricle, the left ventricle, or I'm sorry, the left atrium and the left ventricle. So a helpful tip to use when we're talking about the heart is to remember that the left side of the heart deals with oxygenated blood, and remember this will be the left side since it's the left side to the person. So anyways, so once the deoxygenated blood flows through the right ventricle, it'll go here, it'll go through this pulmonary valve, so we'll label that in green. Now, what valves do is they, first of all, let the blood in, but they also prevent blood flowing backwards. So, for example, you wouldn't really want blood in the right atrium or the right ventricle to flow back into the right atrium. Same thing with the pulmonary valve. You wouldn't want blood in there to flow back to the right ventricle. So the deoxygenated blood is going to flow up in there, and then it's going to go to the pulmonary arteries to get oxygenated. So it goes through the pulmonary artery to the lungs, and then the blood becomes oxygenated there, and it goes through the pulmonary veins. Okay, so then it's going to get through the veins, and will be in the left atrium. So then again, when we're in the left atrium, it's going to want to go through the tricuspid valve. I'm sorry. So now that we're in the left atrium, the oxygenated blood now is going to flow through the mitral valve. So now the blood will be in the left ventricle, and it's going to flow up through the aortic valve, where it will then be sent to the aorta and flow out to body tissues to deliver oxygen and other nutrients. So that is the pathway of blood. I will be going over more of the circulatory system in another video, but just to recap. Blood returns either from below the diaphragm or above. If it returns from above the diaphragm, it'll go through the superior vena cava. If it goes from below the diaphragm, it'll go through the inferior vena cava. let's remember now that we're talking anatomy, inferior will mean above, oh my god, oops. So now let's remember that we're talking anatomy, inferior will mean below, and superior will mean above. So when it gets through the vena cava, will be in the right atrium. So after the right atrium, it'll go through the tricuspid valve. We'll go through the tricuspid valve, then we'll be in the right ventricle. Then we'll go up to the pulmonary valve to go to the pulmonary artery to get oxygenated. The blood will get oxygenated by the lungs, go back through the pulmonary veins, and return in the left atrium. From there, it will flow through the mitral valve to the left ventricle, go up the aortic valve into the aorta, and then to body tissues, and it will oxygenate them and supply them with other nutrients. Thank you for watching this video. Please subscribe to stay updated on my newest videos.